Hi, I'm Dr. Allison Kole, sleep medicine specialist and bona fide chronic insomniac. Welcome to the Sleep is My Waking Passion podcast. Remember, knowledge is empowerment, and if applied correctly, it can help you biohack your way to a better night of sleep, just like I did.
Hello, everyone, and welcome to Season 5 of the Sleep is My Waking Passion podcast. I have for you Dr. Ellen Joseph. So she is a PhD, and she is doing some really interesting, really a holistic approach, doing a lot of cognitive behavioral therapy and even hypnosis to help people who struggle with their gut health. And one of the things I really wanted to talk to her about today was the connection between your gut, its microbiome, how it might impact sleep, what's that relationship like. And we're going to do our best today to dive a bit into that, understanding in full disclosure that it's an interesting topic, but there's actually not a huge amount of data regarding it. So this is sort of new and up and coming, and I think it's a very interesting question, and I'm excited to see what the future holds. So the background for Dr. Joseph is as follows. She is a licensed clinical health psychologist. She works for GI Psychology based in Virginia. She has a wealth of experience working in integrated medical settings, and she has a passion for treating patients of all ages who have chronic and acute medical conditions, especially those who have gastrointestinal disorders. So that's all of your stomach and your intestines and your colon and all the things that we sometimes hear about people not feeling so well in their tummy. And I certainly am someone who has lived with a little bit of GI distress, or IBS, that's what I call it. I have no idea if that's an official diagnosis or not, but I will call it that. So she really enjoys treating these patients, and she also wants to sort of debunk some of the stigma and the impact of these GI disorders on patients' lives. And she's giving them the ability to reclaim their lives, which I find so fascinating. So, Ellen, welcome. It is so awesome to talk to you. I gave sort of broad strokes about what you do. Can you share with people a little bit more specifically what it is that you do, and are there any specific GI disorders that are, particularly in your wheelhouse, or you think you're particularly adept at seeing, or just maybe see a lot of that's very common?
Well, Dr. Kole, thanks so much for having me. It's so great to be here. At GI Psychology, we see a variety of different GI disorders. So we think about those that are more functional in nature, which nowadays we're understanding are the disorders of gut-brain interaction, and we can talk about that a little bit and what that means. These include the disorders where you've done all your testing, you've done all your lab work, your scopes, and everything's coming back normal, and you feel far from normal. This can be in the upper GI, this can be in the lower GI. Think of things like IBS, functional nausea, functional constipation, folks who have functional dyspepsia. All these different diagnoses fall under this umbrella of disorders of gut-brain interaction, where testing is quote-unquote coming back normal, and symptoms are challenging to manage. We also treat folks who have more of our structural or organic GI disorders. So think of things like inflammatory bowel disease, folks who have GERD that is exacerbated by stress, just to name a few. And then we also see folks with more complex medical conditions, chronic pain, fibromyalgia, POTS, different conditions that also the nervous system plays a role in symptom presentation. So we treat a variety of different concerns using these behavioral interventions that you mentioned earlier, where we see really significant improvements in symptom management and helping folks get their lives back. That's a really big goal of our practice.
That is wild. So in terms of the gut and what lives in our gut, what we call the microbiome, and how that might play a role with sleep and other processes, can you give folks a broad stroke understanding of how you approach the gut and how you see the microbiome, influencing these kind of factors?
Absolutely. I think first let's talk a little bit about what is the gut-brain interaction and where do things go awry, and then how that can potentially impact sleep. So our brain and our gut are constantly in communication, every single one of us. So knowing when we're full, knowing when we're hungry, knowing when we have a virus. That's all going through this communication system in our body. And this is all nervous system based. So it includes our central nervous system, so our brain and our spinal cord. And then our gut communicates through the enteric nervous system. So this is like a communication highway. And for some of us, this system goes awry. And this can be for a variety of reasons. Genetics, an infection, chronic life stress, having chronic constipation or diarrhea. And as a result, this system gets really sensitized and it starts over communicating. So that sensations in the gut that typically are typical, right? Maybe some bubbling in our gut after we're eating or some movement through the intestines gets magnified, amplified, and distorted by the brain. And this is called visceral hypersensitivity. So we feel things more intensely and it gets really, really uncomfortable. And then as a result, our brain responds, because that's what our brain loves to do in trying to help us and protect us. And it inadvertently can start really zooming in and looking for these symptoms. It gets really hypervigilant. And it's saying, okay, where is that symptom? When is it coming up? And how are we going to deal with it? So then the brain is really zooming in on the gut's sending up these signals, and it's getting very distorted, and folks are getting caught in this very vicious cycle. Then we add in things like secondary mental health concerns that can also play a role in this cycle and exacerbation of symptoms that a lot of folks feel like they can't get out of. So these result in those disorders of gut-brain interaction. Now, when we don't feel good, it's really hard to sleep. Be it a stomachache, be it nausea, be it acid or heartburn in our esophagus, that naturally, when we're not feeling well before sleep, our mind can start to go, oh no, am I going to be able to fall asleep tonight? How is this going to go? Gosh, I'm so uncomfortable. Am I going to have to go to the bathroom? Maybe I need to go to the bathroom again before I fall asleep. And then all of a sudden we get more amped up and we're having a hard time initiating sleep. And then the opposite is also true. If we're not sleeping well, our bodies are all out of whack. So we really count on sleep to help regulate our hunger cues, to regulate our fullness cues, to help us manage stressors as they come about the day. Think about that night. Maybe I have parents in the audience here where you've gotten maybe 3 hours of sleep and you stub your toe and you want to lose your mind because you have nothing left. Your tanks are empty. That we can't manage these symptoms and these concerns as well when we're underslept, which then therefore feeds the cycle as well.
And I just wanted to add to that because I love the way you're constructing this in a really practical way. Some of the data that sort of supports what Ellen is talking about, they've actually looked at people that are sleep deprived. By definition, you're just not getting enough sleep. And hello, I can tell you for me, my issues definitely, and like you said, Ellen, there's a slew of reasons, be it stress from work, family pressures, etc., where a lot of us aren't getting enough sleep. And what you need to understand that can happen is there's been some data, and sometimes it's a bit conflicting. So some people say that they've found this, other data kind of conflicts this, so I don't know, but it makes sense to me. People have been able to demonstrate that your gut microbiome will change as a result of you basically not getting sufficient sleep. Mm-hmm. And interesting, I think the one study I did see that was very recent that I found fascinating was they took a look and they did samples of people's guts. And they looked at the type of bacteria in there. And, broad stroke conclusion was, well, if you have a lot of variety, you tended to have a longer sleep time, you didn't wake up as much, you fell asleep quicker. Fascinating stuff. So is it true and unrelated? I just don't know that I think that that's correct. I mean, it's very hard to prove A plus B equals C, and I've said that before on the show. But I think, Ellen, you're bringing up a really good point, which is we could look under a microscope and try to really prove our hypothesis. But if we take a step back and just look at what you're actually seeing in real time, it's almost like, all right, well, there's got to be this connection there. There's got to be a relationship there.
Absolutely. The brain and the body broadly are just so strongly connected. And I think if nothing else for folks to walk away from today, I want you to understand that our brain is our powerhouse, right? It's what makes us human. It's what makes us so advanced as beings in this world. And our brain loves to learn and our brain loves to protect. And In some instances, it's doing too much because it's trying really hard to help you. And what if we could use the brain and channel that power in a way that works for you? And that's a lot of what we do at GI Psychology, is using and harnessing this power to really shift the experience of these symptoms and challenges in the body, as well as help with things like sleep, because it is such a key part of our health and well-being.
So in your clinical experience, what have you found works to optimize some of the symptoms? Like if you want to give an example of, you pick whatever you want, but I'd love to kind of know real time how cognitive behavioral therapy works, how hypnosis might work to influence our gut, because that's just wild to me that literally you could go to somebody and be able to not have diarrhea or be super constipated. That's mind blowing. Like, what a great experience. Or have less reflux. Gosh, all of these symptoms, man, everybody knows. I joke because my husband is like, Allison, you always talk about your poops. Like, I had a great poop. This is fantastic. I really do, because there's nothing like a good poop.
Right.
So I'm curious to know, because it really makes me feel good. Like I'm in a better mood. Totally. So how do you get cognitive behavioral therapy, of all things, that we typically associate with insomnia or psychiatric conditions, to work?
I think one of the most common diagnoses that we treat, and where we have a lot of evidence to support these approaches, is with IBS. And there might be some folks on the call who might have this diagnosis, or folks who maybe have skepticism around it. I sometimes hear that folks come in, they're like, I've gotten this IBS diagnosis and it's so frustrating to me because it feels like I still don't have an answer. And we know that clinical hypnosis together with cognitive behavioral therapy is so effective for symptom management. And this is why. IBS, amongst many of these others of disorders of gut-brain interaction, involve the nervous system. And no one hands you a manual when you get this diagnosis and says, this is the best way to optimize using your brain to cope with this diagnosis. So what does our brain do? It tries to figure out how to protect you. So some folks will come in and tell me, whenever I eat this food, I automatically have diarrhea 20 minutes later, so I can never eat that food again. And then that list starts to grow. And now we have 20, 25, 30 foods on this do not eat list. And now all of a sudden, now we've also added certain restaurants. Well, whenever I go to this restaurant, I always have my symptoms, so I can't go there. And then we have situations. I can't go out to large group dinners that are after this time because my symptoms tend to get worse. Because what's happening is the brain is starting to condition. It's starting to associate these different pieces of their experience with their symptoms. So then the world starts to get smaller. And then I have folks coming to me saying, I can't go into work anymore. I can't go out with my friends in the evening anymore. I'm doing less and less just to try to avoid getting symptoms. And we're functioning from a place of fear, and that these symptoms are really dangerous. So with cognitive behavioral therapy, we start to really break down, what is this pattern for you? What are those triggers that result in these thoughts about worry about the future, worry about the impact of your symptoms? What are the emotions? And then how do we respond? And how do we actually break that cycle? So instead of, let's say you sit down on the toilet, Allison, and you're like, this was not my best poop today. Instead of going, well, the day's shot, I'm going to have to cancel that because I feel like I haven't gotten all my poop out. Or that was a loose poop. My stomach's not going to handle the rest of the day. We can go, okay, just because it wasn't a great poop doesn't mean it has to ruin the rest of my day. And then we minimize the worry or the frustration that actually activates the nervous system and feeds the symptoms. So that's the CBT component. Clinical hypnosis, there's probably some folks on the call that think I'm like talking about something really woo-woo here. And I promise you, this is not how it's portrayed societally. We're not using clocks and watches. We're not snapping our fingers or using magic words. What we're doing is teaching you how to harness your concentration and imagination to desensitize that gut-brain interaction. So we get folks into this really, really relaxed, calm state. Some folks might be big fans of meditation. There's some overlaps there. And then what we do in this really relaxed state is we use what are called suggestions. And these are really aimed at promoting healing in the gut, aimed at improving your coping with symptoms, decreasing the severity of symptoms. And what we see is that desensitization occurs where you're not feeling the sensations the same way you used to. And these two treatments together can really help folks not only experience short-term but long-term relief from symptoms.
Wow.
And now a quick break, but don't go anywhere. We'll be right back.
Struggling with sleep? Dr. Kole is here to help. Whether you need a comprehensive sleeping coach program, suspect you have sleep apnea, or simply seek a second opinion, she's available for consultations in New Jersey, New York, California, and Georgia, with more states coming soon. Schedule your free 15-minute consultation today to find out which visit is right for you at AskTheSleepMD.com and start your journey to better sleep with a trusted physician.
If you are liking this podcast, if you're finding it educational, if you are feeling more empowered to go to your doctor with any sleep issues that you might be having to address them, please, please, please lend your support. Make sure that you are liking, following, subscribing. I am available on YouTube. I'm also on Apple, Spotify, or wherever you get your favorite podcasts. The website has launched. So we have AskTheSleepMD.com to be your free educational resource. We've added many new blog posts filled with juicy information. If you would like to support the podcast, we now have a way for you to donate. This is a labor of love. I truly enjoy what I am doing. It would be inspiring and truly helpful if you wouldn't mind even so much as donating $1 to keep this podcast going, particularly if you really find this free education a good platform for you and a good resource for you. I also have affiliate links for products that I'm a proponent of, such as Quiet Mind. So please check out the website, sign up, and you will get the latest news, the latest blogs, some sleep tips, and just have a great day and keep listening. Okay, guys, sleep well.
How does this play into people who truly have a medical comorbidity, like inflammatory bowel disease, for example? So for the audience listening there, irritable bowel syndrome, I think any of us can relate to this. There's times when our guts just, we may tend to be constipated. Take travel, for example. Some people, they just have a difficult time going when they're not at home. They can't relax to the same degree. If that's happening consistently, or as Ellen mentioned, you're now finding that you're worried about having diarrhea or worrying about being too constipated, just using that as a global example, that's sort of really functional in essence, right? There's nothing, as she points out earlier, there's nothing truly intrinsically like there's not going to be a scope that's going to show inflammation or what have you. But then there's a whole segment of the population where you really do need quite a bit of medical intervention because you may truly have an autoimmune process, some sort of a colitis or inflammation in the bowel, for example, that could be contributing to your symptomatology. How does your role fit in with basically this is a great example of the marriage of you have to have your Western medicine that controls that inflammation, lowers your risk for cancer, etc. But how do you fit in with that?
I think a couple ways. I think first and foremost, coping with a chronic health condition, having a psychologist, behavioral health provider, social worker, therapist on board to support with that is really key, right? Because what can happen is we kind of think about that fear response earlier. When we go through really difficult events in managing our chronic medical condition, our brain learns. And then we see high levels of things like anxiety, depression, and post-traumatic stress symptoms in folks, particularly with inflammatory bowel disease, given the course of that disease and the periods of ups and downs with flares and symptoms. So I think that's one piece we absolutely support with. We're also seeing more as well of folks who are coming to us with both the diagnosis of IBD and IBS, where their IBD, per lab work, per scopes, there's no inflammation, everything's well managed, and then folks are still experiencing those breakthrough symptoms, that urgency, those loose stools, the cramping, the discomfort in the gut, because in some ways that IBD is like a trauma to the gut, and the brain very naturally is now surveilling the gut to inform you of when it's feeling those changes. So we can support with those breakthrough symptoms using those same techniques that I talked about earlier, as well as helping to improve coping when symptoms do arise in a flare, and promoting health and healing in the gut long term. So we have an IBD-specific hypnosis protocol we can utilize that's been validated through research as well.
In addition to the behavioral suggestions that you make, do you ever work in tandem with any other types of specialists, and do you find other holistic strategies kind of really partner well with what you do? I'm thinking nutrition, for example.
Mm-hmm. Absolutely. So I think especially for really any of these diagnoses, a holistic treatment team, an integrative, multidisciplinary treatment team is really key, because we each hold an area of expertise that can have a really positive impact on symptom management. So, of course, working with GI providers, nutritionists and dietitians, pelvic floor therapists can be a really incredible addition to the treatment team. Some folks choose to work with functional medicine providers or integrative medicine providers, primary therapists. So if you're somebody who's been working with a therapist on maybe some longer term mental health concerns or challenges throughout your life, that's an important part of the team as well. So the sky's the limit in some ways, because I think for different folks they find different multidisciplinary members are really helpful for their care. But yes, very much extends beyond just myself and the GI provider.
Pelvic floor specialist. Ooh, you threw out a curveball there. I wasn't anticipating hearing that one. All right, tell me more about that and how that manifests.
Yeah, so we see for these folks, I would say, especially in our lower GI-related concerns, there can be different exercises and treatments that can be incorporated to support with muscle tone and overall functioning in the lower GI tract, so in the rectum and in the anus. So our pelvic floor therapists have a variety of different tests and exercises that can improve that area. And I think especially if we have any women here, maybe you've had a C-section, you've had children, and your pelvic floor is not the same since then. I'm learning more and more as I'm working with these providers how they can support getting all these muscles kind of working and all the overlap with the organs, because we have a lot happening down in our pelvis as women, so that it's really functioning well and everything is moving through at rates that work for you. You're able to pass your stool. You're able to even sense when your stool is there. So they have a lot of different interventions and supports that can be really supportive for folks.
One of the things that you had pointed out to me in our discussion previously is your hope is that someone doesn't need to call Dr. Ellen up every time there's an issue. That you want to try to help them, to teach them to be really independent and eventually be able to fly away, little birdie. You've got this. You've got this. What does that sort of look like if somebody was interested in working with you?
Absolutely. So when we think about this treatment, this is meant to be a time-limited treatment. And what that means is you're not signing up for therapy for the rest of your life when you work with a GI psychologist. We have these brief treatments that are effective and that work, so that when you get to the end of those treatments, I always say to folks, I want you to say to me, Dr. Ellen, I'm good. I've got this. I can manage this no matter what comes. And then we wrap up treatment there, because you've gotten the skills you need and the strategies to continue to practice if and when you experience those symptoms again. We also like to think a lot about treatment as episodes of care. So if life changes, if a curveball is thrown your way and we're noticing a significant change in symptoms, come on back. Let's do another brief episode of care, refresh those skills, adapt them as needed, and then send you on your way again, so that you're feeling really empowered to be able to manage your symptoms.
How many people do you think really need to come back for multiple multiple sessions, or multiple rounds, if you will? I don't know if that's the right word to describe it, but
yeah, like different episodes of care. Yeah, I don't have a specific number. I think it really varies. I have folks who have through one episode of care, they got what they needed and they're moving forward. Other folks who something unexpected happens, maybe they get really sick from an infection that they got while doing X, Y, and Z, and they noticed their symptoms came back and they needed either a booster session or a couple sessions. So I don't have a specific number. I think it really varies.
Well, this has been such an enlightening and interesting discussion. Anybody who's listening here, if any of this resonates or is something that you think you could benefit from, you could always check out GI Psychology. If I recall correctly, I think you're part of an organization, but it's really a network that covers like almost every single state.
That's correct. Yeah. So we are a fully telemedicine practice. We are a group practice. So there are a variety of providers working as a part of our group. And we are able to see folks in all 50 states, including DC.
That is really cool.
Yes.
And leave here knowing that, if there's any motivation, if you're having some GI symptoms and you're not quite able to explain it, I can tell you that there was definitely a correlation between my gut coming down and my sleep getting better. Mm-hmm. There really is a relationship here. You want to be mindful that if there are certain foods that might be triggers for your symptoms, see if that's influencing your sleep as well. Because I've talked on the show about the importance of slowly improving your fiber intake, which might help with your sleep quality. There's been some data to suggest the Mediterranean diet, for example, is great for that. You want to make sure you're eating whole, healthy foods. Certainly, living off of fast processed food is probably not the best plan or not the kindest thing you can do for your gut. Unfortunately, from what I was able to glean and what Dr. Ellen had mentioned to me, there's not a ton of magical stuff that we can do to make your gut symptoms suddenly better. So I'm not aware of any literature that says if you take this prebiotic or this probiotic or any of these things, that suddenly your sleep's going to be better or that gut relationship's going to be better. So it sounds like it truly is a little bit deeper.
Yeah, absolutely.
Do you have any final words for the audience before we wrap up? And also any, suggestions that you would make for them in terms of where they might be able to find you or any other juicy tidbits of information you might have. I'm going to have all of that posted in the YouTube channel and on Spotify, but just in case she has any other thoughts.
So I think first and foremost, if you're someone who is here having challenges with sleep, having challenges with your gut, you don't have to suffer. And if that's ever been a message that you've received, like you're just going to kind of have to live with that forever, I want you to know that that's not the case and that there are really effective treatments that exist. And I know it's uncomfortable to talk about poop and nausea and vomiting and all those things, and that's exactly why we're here, so that you have that resource to have these really honest conversations and get that support you need. Also, this is not all in your head. I know that I'm a psychologist on this recording and on this podcast, and I think sometimes folks walk away from this conversation like, oh, she's saying that I just need to be less stressed and everything will feel better. No, absolutely not. This is so much more complex than that. And we as psychologists and as behavioral health providers can help you with symptom relief. So know that we hear you, we see you, your symptoms are real, and relief is possible. You can definitely check us out at gipsychology.com. We're on Instagram as well, GIPUSA. We have a YouTube channel. We have a LinkedIn. So check us out, get connected. We do provide a 15-minute free phone consultation. So even if you just want to learn more and see if this could be a good fit for you, schedule that with a member of our admin team, and they're happy to let you know if we would be a good fit for your needs.
Thank you, Ellen. It's been such a pleasure to connect with you. I'm so happy Dr. Val got us together.
Yes, likewise, Allison. This was great.
Disclaimer. The statements made on this podcast have not been evaluated by the U.S. Food or Drug Administration. They are not intended to diagnose, treat, cure, or prevent disease. The information provided by this podcast should not be used as individual medical advice. While I am a practicing sleep provider, I am not your sleep provider. You should always consult with your personal healthcare provider for individual recommendations and treatment.